What's up, folks? What's going on? Pastor Dixon here. Wishing everybody a good evening, a wonderful evening. We stop and tag some folks right quick. Hope everybody had a great day today. Let's see. They really get bogged down in what's going on around us, man. We can be overcome. So we can't let that happen. Tag a few people here. Uh-oh. Sorry, I got one. Okay. Yeah, we ought to have a good conversation tonight. Good live tonight. Based on some things that's just been laid on my heart that we do need to talk about. Of course, we're going to do the coronavirus update to keep everybody abreast on just how serious this situation is, because there's still folks out here playing, shucking and jiving, and ultimately it's going to cost lives. I pray that I'm wrong. Y'all please don't understand me. I hope I'm wrong. And if I'm wrong, I'm going to be the first one to come y'all to see the special live broadcast of Pastor Dixon coming back to say, man, I was truly wrong, and I am so grateful that I was wrong. But as of right now, it points to the fact that I might not be too far off in what I'm saying. Okay. And so tonight we're going to talk about another aspect of this coronavirus. After we date on the coronavirus, we're going to talk about the impact that this coronavirus has on communities of color, people of color. Now, I just want to clarify now, when I talk about it tonight, I'm not going to be talking about the economic impact that the coronavirus is going to happen. What's happening, folks? Good to see folks. All right. It's a good group of people on already. Alrighty. Yeah, just to clarify, I'm not going to be talking tonight about the impact that the coronavirus has on the community as far as economics, okay, economically. Okay, I'm not talking about the financial impact that the coronavirus will have in the black community. I'm going to talk about the physical impact that it's having, that it not only is having, but will potentially have in the communities of people of color. Okay, so again, I hope everybody's had a wonderful day. Missy, good to see you. Brandon, yep. Alouette, pray I got that right. Twitch, what's going on? I don't know how to pronounce your name, but it's good to see you. All right, Gina, what's going on? All righty. Yes. We do need help. We need help. We need a miracle right now. And I talked about it in one of my other lives that I do believe in miracles, and I would really love to see tomorrow we get up and the emergency rooms and the hospitals and everything, just this whole situation just go away. I would love to see that. And I do believe that it can happen. But in the event that it doesn't, this is the new reality. And this reality is not only going to carry in this season, in this 2020, there are going to be some long-term repercussions after this that we're going to have to adjust to, actually. We might not ever get back to a place where we are the embracing society that we were of the past, or shaking hands. We might not never get back to that era. I've been seeing comments from the scientific community about possibly going to everyone wearing masks even after this thing is over. So we might have a new normal in our midst today, something that will antiquate all of the social mores and the way we behaved prior to 2020. And a whole new era from 2020 forward might be coming to pass. Don't know. But I do believe in miracles, and I pray hard that a miracle happens. Until then, we got to work. And I'm going to talk about putting in work tonight as far as this whole thing. I don't know whether you all know it, but some of y'all do. My wife is a respiratory therapist, and every day that she goes to work, she puts herself in harm's way by going to help others. And I just, I want my wife to come home every day and not to come home carrying something that neither of us wants, that may kill one of us or kill someone around us. We got to fight. We got to stand up. And it's each one of our responsibility. It's the responsibility of each one of us to make a stand against this coronavirus. To keep from spreading this thing, we have got to confine and contain it now, because this is a beast, folks. It is a beast. Evangelist Michelle Felder, what's happening, my sister? How you doing? Keandre, what's going on? Tom, what's going on, my brother? All right. Queen Christine in the house. JD, what's happening? All righty. All right. Let the truth be told. For sure. Pastor Ravenel, how you doing? Black man, what's happening, Tony? All right. All right. Felicia, how you doing? Sean? All righty. Councilman Mike Brown, what's going on? All right. Good to see you. Sean, yep. Deborah? Yeah. Yeah, Jeannie, you said, please talk about the illnesses has on the black community, because many are missing that part. You're right. You're right. Stand by. Stand by. Jamie, how you doing? All righty. Yes. Merrill, how you doing? All right. Brady campaign in the house. Thank you for all you do. And thank everybody for all that you do in here, in the house, in our community, for others. We have an amazing community of people here who are really true public servants, who get up every day to make the world a better place for everyone. And there's so many that are on right now, so many others. Good to see you, Julius. Red, what's going on? All right. SOC in the house, for sure. So many that are doing really amazing things for our community. But our community is under attack right now. Our community at large is under attack. The world is under attack by a killer, a beast. And this killer don't care who it is or whatever. That killer, he's coming for folks. And he's called Corona, that coronavirus, COVID-19. And a lot of folks, as I've been doing this since, I think I started my first live on March the 14th. On coronavirus, and trying to stress the severity of this, while others were trivializing it, while our federal government, our president, were trivializing it, talking about it was a hoax and all of this here, instead of putting up defenses that might have protected the people. When I heard about what was going on, it ain't no joke. This ain't no joke at all. Kathy, how you doing? LT, what's going on? Cynthia, good to see you. All righty. So how serious has this thing been? Okay, our first death in the United States, not in South Carolina, but in the entire United States, happened on February 29th or March 1st. It was either the last day of February or the first day of March, okay? Which we're looking at right now is like 35 days ago. That ain't too long. 35 days, that's not too long at all. That's when we had our first death attributed to the coronavirus in the United States. 15 days later, that number had jumped up to 85. And a lot of folks, that was March 16th. A lot of folks, well, it ain't that bad. Okay, yeah, it's just a flu or whatever. And just a couple of people. So that was 15 days later, March 16th. 84 more than that first day. 7 days after that, March 23rd. 7 days after that, that 85 had jumped up to 501. 7 days later, that was 417 more in 7 days' time. 4 days later, that number went from 501 to 1,575. In 4 days, this time, 1,074 people died. In 4 days. 2 days after that, Sunday, March 29th, 2 days later, the total number had jumped up to 2,435. Now remember, this is March 29th now, from March 1st. 29 days, now the number is 2,435 dead in the United States. Okay. I want y'all to hear this, okay? 2 days after that, that number had jumped up to a little over 3,700. That's about 1,200 in 2 days, right around 1,200, about 600 a day, 2 days. Okay. At this time, global deaths were right around 4,000 deaths, a little over 3,700 deaths. Today, know how many we got today? 9,458. From last Tuesday to today in 5 days time, 5,700 people died. 5,700 people in the United States died from the coronavirus, COVID-19, from last Tuesday until today. Over 1,000 died each day since last Tuesday. And I remember way back, right, when I first started this, and back when it first started, it's just a flu. More people die by the flu, and this is true. About 60,000 a year die by the flu. But there's nothing, they've never seen anything that ravages people as quickly as this does, and that we don't have a vaccine for. We have no way to stop it. The symptoms, they appear after an incubation period. And during that incubation period where there's no symptoms whatsoever, people look just normal, they're still highly contagious and can pass this coronavirus on to other people without even knowing that they have the coronavirus or that they're passing it on. That's why this thing's so deadly. That's exactly why this thing's so deadly. Ray, what's going on? Elizabeth, how you doing? All righty. That's why it's so deadly. So that's like on that global rate, right? Global rate, we went from 40,636 last Tuesday to today, it's 69,082. We gained 28,000 deaths around the entire globe in 5 days. 28,000 people died in 5 days around the entire globe. 28,000 people. Ain't that bad. It's just a little flu, right? That's all it is. And in the U.S. death rate, right? On Tuesday, we had about just over 3,700. As of today, 9,458, just like I said. A jump of over 5,700 dead. That's crazy. That's crazy. Last Monday, a week ago tomorrow, the highest rate of death in a single day last Monday was 575. That was the top. It had topped out at 575 1 week ago Monday. Right now, it's over 300. Today, over 1,300. 1,300 dead today. One day. 1,300. And that's in the United States. That's in the United States. That ain't overseas or nowhere. That's right here. Some of them died right here in South Carolina. Some of them did. What's happening in South Carolina? Well, as of right now in South Carolina, we only have 40 deaths. And I use only very, very, very lightly. Very lightly. Because more is coming. More deaths are coming, okay? We're up to 40 deaths in 19 days. And no matter how folks want to trivialize this, if it's either you or one of your loved ones who have... What's up, D? How you doing? All right. Good to see you. Chanel, what's going on? Good to see you. That's all right. If it's either you or one of your loved ones that has died, that's a big deal. It's a big deal to you, for sure. So for those who might not have been directly impacted by it, for others who trivialize this and say, well, it was only 40 deaths. Well, if one of your loved ones was one of those 40, it wasn't an only one of that. It was a very important one. Very important. And what's going on? Good to see you. So in South Carolina, okay, let's just say across the United States, on March 16th, and I said it before, there were 85 deaths across the entire United States. Today, there's a total of 9,300, what did I say? 9,458 today. But in the state of South Carolina, there's been 40 deaths so far. So far, we're doing good. But it's a progression. It's a progression. It's a process. And we're at the beginning of the process. We're not where New York City is. New York City has moved on in the process. They're ahead of us. Just like when we got a warning from Italy, they were ahead of us. Then a warning from Spain, and they were ahead of us before New York started their process. And now they're ahead of us. And they're warning the rest of the nation to, man, watch out, it's coming, it's coming. So right now, we're at the bottom of that. Say they talk about flattening the curve. We're at the bottom of that curve, and I'm going to tell you, we ain't doing nothing to flatten the curve. We just moving right on into this thing, straight up. And that thing is going to go from a curve to a steep hill. And it might not happen too much longer from now. Stand by. So as far as the deaths we've had today, Richland County has been our most deadly county so far. They've had 6 total deaths in Richland County. Florence County has had 5 total deaths. Horry County has had 4. Beaufort, Lexington, Anderson, and Sumter County have each had 3 deaths. And the remainder of those 13 deaths, to make the total 40, happened over 10 other counties. Now, the Charleston County, we only have 1 death reported. 1 death reported. I'm just going to say this, and I'm just going to put this out here like that. Charleston County's 1 death. I don't know. All right, y'all take care. All righty. Charleston County's 1. I don't know. I don't know if that's the only death that Charleston County's had. Sometimes I just can't trust them. It's possible. Anything's possible. So those are the numbers. Those are the numbers right there. You can't deny the numbers. These numbers are factual. You can look them up any way you want, And for those who are still acting like this is all right, it's nothing, it's just a little old flu, well, it's a little bit worse than that. And people are dying. People are dying. As a matter of fact, the health organizations, because of our lackadaisical attitude here in the United States, it's estimated that before this is over, that Rona, carrying on like nothing else happening, kicking it out at the grocery store like ain't nothing happening. When other countries have said, man, the only way we was able to shut this down was to shut our country down, our cities down. Anybody on the streets had to have paper to move. Government issued papers to move. That's how they beat it. What's up, nephew? All right, Faye, how you doing? Good to see you. For sure. So those are the numbers. For those who want to deny the numbers, go right ahead. That we jumped up from last Tuesday till today, 28,000 deaths from last Tuesday to today globally. Okay. Anytime we look at a jump from 3,700 to almost 9,500 since last Tuesday here in the United States, this is serious, folks. This is serious. But, it's amazing, though. It's amazing how things have a way of affecting some communities more than they do other communities. And the data people have been gathering this data, and they're starting to see trends that inside of Black America and the communities of people of color, we're being affected even worse by this virus than other communities are being affected. Now, I started out by saying I'm not talking about economic impact tonight. I'm going to talk about the impact of the COVID-19 coronavirus on Black America and communities of color, but I'm not going to talk about the financial impact or the economic impact tonight. I'm going to hold that one off for another conversation tonight, because I've been talking about the lethalness of this and the death toll. I want to talk about the physical aspects of the impact that this is having on poor communities and communities of color across the United States. According to a report by Sam Baker and Allison Snyder of an online publication called Axios, okay? Now, Axios is a nonpartisan online publication that believes, contrary to what people say about the media, they believe that truth and facts exist and that truth and facts must be highlighted, repeated, defended, and cherished in journalism. I kind of like that. I kind of like what they have to say. But what I'm getting ready to pass on is according to Sam Baker and Allison Snyder of Axios, okay? And they say that the coronavirus hits people of color harder than any other subset in the United States. And this is the preliminary data, okay? The reality is that communities of color and low-income families are bearing the brunt of the coronavirus pandemic in the United States. Now, although this virus doesn't discriminate, it doesn't discriminate. It can and will attack anyone and everyone. But the most at risk are the elderly and people with weakened immune systems due to pre-existing conditions, whether that condition is known by a person or unknown, but it's been found out through tracking this thing that along with that at-risk group, elderly and people with pre-existing conditions are people of color and poor people. Let me touch on that, whether the condition is known by the person or not. Okay. A lot of people don't realize that they have pre-existing conditions, don't even realize it. And a lot of people who interact with them, family members and everything, don't know that they have pre-existing conditions. And so anytime a person that is infected by the coronavirus be infected by the virus, and ultimately it could kill them, okay? I just wanted to back off and say that, okay? Alrighty. So most of the time, coronavirus is predominantly attacking the elderly and people with pre-existing conditions, although it has also been seen that coronavirus attacks healthy people too. There are healthy people and young people that are dying from coronavirus, okay? It's not just that way. But although it doesn't discriminate, though, the cases and the casualties are beginning to reflect the racial and socioeconomical disparities of the cities where the virus is spreading. So in other words, New York City, Chicago, Detroit, New Orleans, all of these different cities where the virus is going in, they're starting to recognize trends of those that are getting admitted to the hospital, and they're not just the elderly or those with pre-existing conditions alone. They're looking more like black folks, brown folks, and poor folks. At this time, there's no nationwide data, though, on the demographics of coronavirus cases or the deaths. None whatsoever. There's no nationwide, okay? But preliminary data from several large metropolitan areas seems to be very clear. And here's some of it, okay? Black residents make up about 33% of Mecklenburg County in North Carolina, which includes Charlotte, okay? But they currently account for roughly 44% of its coronavirus cases, according to the Charlotte Observer. You hear me? 33% of the population in Mecklenburg County, African American, black folk. But they make up 44% of the coronavirus cases. Nearly 50% of the coronavirus cases there are black folk, 44%. In Milwaukee County in Wisconsin, that county is 26% black. 26% of the county is black folk, yet African Americans account for almost half of the coronavirus cases and 80% of the deaths that are there, according to ProPublica. 6% of the county is black, but they account for nearly half of the confirmed coronavirus cases, and 80% of the deaths there are black people. The hardest hit neighborhoods in New York City have large immigrant populations, according to the Wall Street Journal. And they're being hit very hard by it. Why? Because of the poor conditions they're living in. Statewide data from Michigan shows that African Americans make up a plurality of both cases, 35% of the cases, black folks, and 40% of the deaths, of the state's population. But when it comes to coronavirus, they make up 35% of the cases and 40% of the deaths. That ain't right. We're under attack. This virus is coming straight toward black folks in a way that it's not affecting other folks, other ethnicities, other subsets, and predominantly white folks. And I'm going to talk about why. It's crazy though, especially because when I look around now, and I'm going to talk about this more too, I see a lot of times I see us just acting like, oh, it's all right. And we got folks in our community still talking about it's just a little flu, or I'm young, I can't catch it and stuff like that. And the reality is, when we look at the numbers, no, we are at risk. The coronavirus got a target on our backs. And we are one of the most highest at risk. People of color and poor are the highest at risk of catching this virus. Okay, Pamela, how you doing? Diana Salazar, ¿cómo está? Horace, alrighty. It's crazy. It makes no kind of sense whatsoever. Especially when the fact that I'm sure some of you all watch some of these. We got press briefing after press briefing after press briefing here and there. We even had a press conference here of African American elected officials here. But none of them nobody's talking about race and the impact that the coronavirus is having on the poor and people of color. Nobody's talking about this. Black Lives Matter. It makes no sense. So why is this happening though? That's the question. Why is this happening? The reason communities of color and poor communities are taking such a major hit by the coronavirus can be traced back to the pre-existing disparities that we find in our communities across America, where pre-existing conditions in the individual opens the door for the coronavirus to ravage the host, so also do pre-existing conditions in our community weaken our ability to fight off this virus. What, Pastor, what you mean? Pre-existing conditions in our community. Well, it is a fact that African Americans are more likely to have a plethora of underlying health conditions, including heart disease, sugar, diabetes, okay, in the community we call it sugar, all right, hypertension, and some cancers that can make COVID-19 infections even more serious, okay. And I say underlying health conditions because many in our community, we just won't go to the doctor, or we can't afford to go to the doctor. So because we don't know, this virus just hovering around. Well, other people might be walking around not even know they got it or not wearing masks or whatever. And they get to talking and them droplets get to spraying out, and about 4, 5, 6 feet before they drop to the earth. And we all up on them and carrying on because we don't believe it can get us anyway, but we don't know that we got this pre-existing condition, Next thing you know, we infected. That's why one of the reasons why we're susceptible, because as a community, we have a large volume of pre-existing conditions that many of us don't even know we are carrying. For sure. Lower income areas, okay, and this is a reality. Lower income areas, which actually tend to have larger non-white populations, that's a given, isn't it? Lower income areas, the less access you have to health care. That might diagnose the pre-existing condition, and you would know, okay, I'm susceptible to this. Let me stay away from those that I might be able to contract this disease from. See how this domino effect? See how We caught up in this catch-22. We always up under attack. Yep. You know, then in our community, there's the abundance of substance abuse. Abundance of substance abuse. Alcoholism and drug addictions run rampant, right? Another weakening of the immune system. Then we live in what? Food deserts. So there are no healthy food alternatives readily available. Then even beyond that, okay, just because we live in a food desert and there are no healthy choices available don't mean we have to settle for that, but we do. It's our own bad choices too when it comes to eating habits. Yeah, we're going to live off that fried chicken for sure. Everything we ain't supposed to eat, we eating, and everything that we shouldn't be eating or should be eating, we not eating. Last time I've been at a spot where my plate was predominantly green. For sure. That's what we do though. But it's not good for us. And it weakens our ability to fight off this strong virus like that or any viruses. Compromises our system. And that part of it we let in ourselves, okay? We can't point the finger at other people for what we need to be taking responsibility for. We can't do it. Okay? Much of the habits that we deal with, that's the way we were raised. I hate to say it, and I love my folks, but we was raised wrong. And over the years, fought against trying to make any other kind of changes. Hovering around waiting to find that one, actually coming out of people's speech patterns and everything, or sitting on a doorknob or something like that, just waiting for a host. And we don't even know we have a compromised system. We don't even realize it, for sure. Add to all of that, substandard housing that we live in. I mean, you know that living in substandard housing actually affects your health too. Hidden mold, vermin, what they call, rodents and stuff like that. Okay, substandard housing. Multiple families living together. And of course, that's something that, because of the way the economy is now, people are hurting. That multiple families living together is a regular thing today. But when it comes to the transmission and spread of COVID-19, this is another way for it to actually grow and breed and find more hosts, because we all living in the same, and everybody ain't on the same page in the same house. Might be different if everybody in the same page was on the same house was on the same page, but everybody ain't taking it serious. For sure. And then the homeless. We talked the other night at Aaron's house, Charleston, Uplift Charleston, with Faden Santana and Jesse Williams. We talked about the homeless situation there. Our homeless are being just as affected as anybody. They're not immune to this, but their homelessness is not being addressed. It could have been addressed. We could have had our homeless in one centralized location, tending to their needs, helping them to get up on their feet, helping them, not giving a hand out, but a hand up. But instead, the powers that be, fought against it. They fought against it. No. Your hosts for the coronavirus that are interacting with us everywhere we go. You walk up in the parking lots, wherever. Go to Walmart. The homeless there. And if they're not being taken care of, they're just as capable of getting the virus or catching the virus as we are. Their lives matter. And if we protect their lives, then we're protecting our lives. That's how this thing works. That's exactly how it works, okay? For sure. So my people, I want you to understand that we as a people, poor people, people of color, we are once again under attack. And it's because of the pre-existing conditions that we live in. Brought on by the same ones, them same folks who will not shut this city or this state down like the rest of the world. So we need to do anything and everything that we can do to stay alive. Everything. So when we hear about the protocols, when they say to do this and to do that, Minister John Henry, what's going on, brother? All righty. Lori, how you doing? LJ? All right. When they say do this and to do that, when they say they want you to, make sure you're washing your hands, when they say make sure you're maintaining social distancing, staying away from people, do it. When they say stay home, right now the word is real simple. Stay home, stay safe, stay alive. If you don't have to go out, make a grocery list so you don't got to go back to the store every day. One trip. The more you minimize your contact with other, the more you minimize the possibility of catching this virus, and ultimately might be a number in the death column for coronavirus. You don't know. And it's easier to act up front, proactively, in order to save yourself than retroactive about what happens when you get it, how you are going down to the doctor and you get diagnosed at the ER or wherever as coronavirus positive, and they admit you in, and that's the last thing. You don't get to go back home and see your family. If you're destined to die, you die alone. You don't get to hug your grandchildren or say I love you or nothing like that unless somebody's got a phone that they can bring to you. That's how people are dying. That's how that 69,000 have died alone. That's how in the United States nearly 10,000 have died alone. 40 in South Carolina alone. Because once you go in, they can't let you back out because you will contaminate everybody else. This is serious, folks. This is serious. And I got somebody that somebody I love and care for, care about, just asked me, a couple of people, well, why don't you put the good stuff up? Why don't you put the good stuff up? I had to tell them, you put the good stuff up. My job, I'm trying to scare people in order to save lives. Don't like this, right? It's tight, but it's right. That's what I'm trying to do. And I mean, there are some success stories out here. So anybody in the world wants to put a success story on my pages, please, I'm not going to block you. I feel free. But my job is tell the truth about it and hopefully keep from getting somebody sick or having somebody die. You see, we got people that's running our care like I care. They don't care if you think it took ahead of time proactively in order to make sure you don't. So I'm putting this message out, and I'm going to keep on putting this message out. What's happening, Kima? How you doing? Yeah, I use Kima. Okay. I'm going to keep on putting this message out. And for those who want to put out the successes, do that, please. I'm definitely in favor of it. But my job is try to make this thing so everybody, not only within earshot of what I'm saying, but I hope everybody is telling other people, man, get right. They say, stay at home. Stay at home. Stop all that, going out to the stove 10, 12 times and carrying on. Makes no sense to me. So it looks like, COVID-19, the impact on Black America has the potential to be devastating. It does have that potential to be devastating if we don't do anything. If we choose to keep thinking that it's not that bad, it's just a little flu and it's not going to hit us, then we are, amongst us, we're going to die. Period. We're going to overrun Murray's and Dickinson's and North area and Stir. They're going to be overrun. They might be overrun anyway. But if we stop and pull back and say, this is serious. Let me get my children together and my brothers and sisters and my mom and them, and let's let them, we're going to do a Zoom chat just to let everybody know just how serious this is and what we need to do each to not only stay safe, but to stay alive. Yeah, that's my job. That's my job. I go out, when I do go out, and now and then I have to go out too. And go to Walmart. And I don't know if y'all saw on my page, I posted up Ricky Smiley's Facebook Live from, I think it was like yesterday he did it. And the first 8 minutes he talked about I don't understand what is the matter with us as black people. I don't understand it. Man, you go to Walmart, man, we just everywhere. You know, we not practicing social distancing. You know, I went by the Walmart over here yesterday, and I wouldn't get out and go in because nobody there. Was a line out there. Nobody practicing social distancing. Nobody. It was a line, and the line was predominantly black folks. Ricky Smiley said that he left there and he went by Lowe's because Lowe's was open too that day. He said, and he walked inside the Lowe's and like everybody was, you know, first off, it was just very few people there. And then there were distances between. Everybody had on masks at Walmart. When I went there yesterday, nobody, one or two people out of that crowd. Come on, y'all. Come on, folks. If we don't do it, ain't nobody gonna do it. Do it for us. You know, this thing got a target on each one of our backs. So yes, Faith, stay at home. This is real. And if you got to go out, don't make your children orphans. Or don't bring that home to them because they're just finding out that kids are being infected. Children are dying by the coronavirus. And they're doing it. Like I said, I do this because this is my job. I do it because I care. And I hope everybody is taking this and passing it on to other people. I don't care whether you're sharing it or telling it everybody or whatever, having a Zoom chat with your folks or whatever. Tell folks that this is a killer. And it will kill anyone and everybody. It doesn't care. It doesn't care at all. It doesn't care, just like if we don't do what we're asked to do. Right now it's an ask. And it should be actually by command to stay at home. Stay at home. Shelter in place. It should be by federal level for all 50 states. It should be that, either that or at the state level. South Carolina right now is one of 8 states out of the 50 states that doesn't have a stay-at-home order in place. And all 8 of those states have Republican governors. If you don't like the political part of it, it's about time to jump on off. Because I'm going to talk about it right now as I move on into the part about bloody hands. You see, because all of that I talked about all of the deaths and all of the cases that have happened, you see, all of this could have been prevented had we had people in authority who, one, knew it was coming and did something about it, but even now that it's here, refused to do anything about it. Here in South Carolina, Governor McMaster, one of 8 governors out of 50 who refuses to have a stay-at-home, to put in place a stay-at-home order. Okay? Why? Because he don't care. He'll never have a life like what I'm doing right now because he don't care. He don't care. He running up, got his kissing up to the president, you see, and don't want to step. Wonder why all of the 8 that haven't done it yet, why they all Republicans? I got a good idea. And why it is that we got the city of Charleston got a stay-at-home order. City of Mount Pleasant has a stay-at-home order. City of North Charleston ain't got no stay-at-home order. Why? Mayor Keith Summer is a Republican, just like his homeboy, Henry McMaster, just like his homeboy, Donald Trump. Their lives don't matter. Man, I had to laugh at Mayor Summer, what he said the other day in the little press release and carrying on, a press conference, saying that, well, I'm not going to order the stay at home because, first off, I think everybody's going to do that. Well, you got to go to Walmart and go see about everybody staying at home. They ain't staying at home, all right? But then again, he said, okay, well, I'm not going to order it because so far, you know, when it comes to cases, we're not doing as bad as the other municipalities here. That's about crazy. I can't say what I want to say. That's crazy. That's not how you beat a pandemic. You beat a pandemic by getting out in front of it, just like you get your car. You keep your car running well because you do preventive maintenance. You do things ahead of time before stuff break down, right? That's what you do. We'll do something. Hey, crazy as heck. Crazy. Yes, we are. We are expendable, for sure. I'm just bringing that real. I'm bringing that truth, you know. While you stand, how can it's, you know, because we have, and I'm just using numbers, okay? Because Charleston has 8 cases and Mount Pleasant has 10 cases and Goose Creek has 6 cases and we only have 3, then we're not going to do anything. That's not how you beat this monster. How you beat this monster is you do everything that you can up front to block it, to stop it, to confine it and contain it so it doesn't spread any further. That's how you beat this thing. Now, this is a $200,000 a year mayor and $106,000 a year governor. And I'm a high school grad on Social Security, get $800 a month. If I could figure it out, I'm sure they can figure it out. Come on, somebody. This is crazy. They don't care. But I'm here to tell you, because this closing part is about bloody hands. It's about bloody hands. They might not care now. And I know it's probably some folks on here that are atheists or agnostics and don't believe in heaven and hell, don't believe in God and judgment. I do. I'm Pastor Dixon. I believe that there's a judgment. And I believe that whatsoever you sow, you shall reap. For every one of them, for everybody that comes in, because of their neglect, they're going to be held accountable for it. For sure. And there'll be a special place in hell prepared for them. Yes, I said it. Because their neglect is going to cost people lives. They could have been in shut down. We can start now. Well, South Carolina, well, North Charleston is still saying, oh, we good. We good. We good. When them bodies start rolling in, they ain't going to be good. And y'all don't forget. Don't forget. And again, I'll say it. I pray that I'm wrong. And if I'm wrong, I'll be the first one to come back on here and say I was wrong. And I'll apologize and the whole 9 publicly. But I don't think I'm going to be wrong on this one. The data supports that this is coming. And it's going to be bad. It's going to be nasty. The Surgeon General said today the next 2 weeks is going to be something that we never, ever thought that we would experience. The body count is going to roll. You say I'm froze. Oh, okay. All right. Probably my internet. I don't know. Internet connections. Okay. The body count is going to roll. And that's for sure. There's nothing that can prevent this from happening. Had we acted back in January when we first got the word that this was coming, instead of the president talking about it's a hoax, Democrats trying to make him look bad and whatever, had we acted then, we would have gotten ahead of the curve. When the states, okay, great. When the states started hearing about it, if they would have started acting ahead, nobody took it serious. Nobody took it serious. I read that letter from the American citizen living in Italy. I read her letter on the 10th, posted it on my social media pages. And then from that point, it was working on me. It was working. That thing went to working on me. I was like, wow, she's saying get ready. America, you my home. I'm telling you this is coming. This was March the 10th. This was before New York City. Remember, this was before it just blew up in New York City, before it spread around the states like that. Remember, on the 16th of March, we only had 85 deaths. This was March the 10th. She was warning, get ready. And we, Rona, y'all come on in, for sure. Take him, whoever you want. Take whoever you want. They didn't start building up masks, ventilators, gowns, hospital equipment. I'm still waiting. I haven't heard a word about them even starting to do a field hospital right here in the Low Country, just in case. Just proactively, just in case it gets bad. So what we're going to do, wait till it gets bad, then we say, oh, we need to set up a field hospital over here, man. Sit on them. And wouldn't it be more comforting to all of us who live here to know that we had government that not only cared enough to tell us to stay your behinds at home unless you absolutely need to. And while you're doing so, here's some scenes from what we're building over here to take care of the sick whenever you need it. We are ready for you. Wouldn't that be comforting? But instead, what we get? Now, we ain't that bad. No, everybody's going to stay at home, you know. Everybody follows the law. They're going to stay at home. That's what we get. But I'm here to tell you, they can play that game if they want. And there are those in the low country. We're going to lose people. We are going to lose people. But trust me, if it doesn't happen on this side of heaven, it's going to happen. They're going to be judged. Their hands are bloody. They are culpable before and after the fact. For some of y'all have been to jail. They are accessories before and after the fact of every death that happens as a result of this. And I put it up on my social media page. If you lose somebody, a loved one, to coronavirus because these folks didn't do what these elected folks didn't do what they were supposed to do, man, sue the heck out of them. Sue them. Sue them. Willful neglect. Willfully negligent. Sue them. Take their homes and everything. That's just me. That's Pastor Dixon. That's kind of what I do, you know. I tell you, it doesn't make any sense whatsoever, that as we are in the midst of one of the worst pandemics that we've ever seen, and we can talk about the flu and all of that, but the experts say this ain't no flu. This is a killer compared to the flu. And they got no vaccine. Perfecting that vaccine is about a year away. How many people are going to die before then if we don't get control on it? The only way that we're going to get control on this now is through respecting social distancing and cleaning. You know, it's suggested that going in and out of your house, they suggest that you have a place outside of your door where you can change into clean clothes and then just make sure that you wash whatever you have on before you go in. If you come in from outside, wipe the doorknobs down after you go in so that you don't infect nobody else in your house. This is serious, folks. And that's all I'm trying to say. That is all I'm trying to say. This is serious. And I get so angry when I see my people acting like it's all right. Drive past the convenience stores down the way, Andrews and USA, and same folks hanging out in the parking lot, just chilling. I don't get it. They shut down the schools so that the children would not communicate it to one another. Bring it in from home and then communicate it to one another, then infect the teacher, then those that get infected back home and infect the people at home. That's why they shut the schools down, because that was a mass transmission of the capability of mass transmission of this virus. And then those talking about why they shut the school. They shut it down to protect you. They shut it down to protect me. This virus in particular, and make sure that as we come out of it, there's a message right here, as we come out of it, and even while we're in it, that we're laying the groundwork to make sure that all of those pre-existing conditions that I talked about get eliminated. That we don't have to fight for health care within our community. That we don't have to be afraid to go to the doctor because we can't pay a copay. That we make sure that in our communities we have the ability to eat right and to exercise right, just like everybody else in their communities do. Because all of those things compromise our immune system. And when something like the Rona come along, that Rona is looking straight for us because we have a compromised immune system. And the data that's being amassed right now is supporting that fact, that black people, brown people, and poor people are more susceptible to coronavirus COVID-19 than any other demographic. And we ain't going to change that unless we change it. We all we got. This is Pastor Dixon. I'm a couple of minutes ahead of schedule tonight, and I'm going to call it a night. Please let it sink in, though. Let what I said sink in. And then tell somebody else. Don't be afraid. Don't. You might save their life. Don't let just, fear of speaking to someone stop you. Make sure you stay 6 feet from them, though, okay? But let them know. Wear your mask. And let others know that this is serious, that this thing can kill you. Watch Ricky Smiley. Look, I posted it up on my page, but I said watch the first 8 minutes. Because after the first 8 minutes, it's his remedies for this whole thing, okay? And I don't know the validity of it, so please, I couldn't chop it up, okay? So please, just go for the first 8 minutes where he talks about how we as a people continue to neglect the warning. We can't neglect the warnings. We can't neglect the warnings. If y'all don't do it for anybody else, and I'm going to just put this out here, Pastor Dixon, please do it for my wife. And do it for the other healthcare professionals who have to deal with this every day. Not only do they have to deal with the death and dying aspect of it in the hospitals, they also have to deal with the fact that they have to come home to a family, and they're trying to figure out, what am I going to bring this home to my family? What if I jeopardize my family? In a lot of these hospitals where they don't do what they say do, the less are dying. That means they're not being exposed to it as much. Shout out to our healthcare workers. Shout out to the food service folks inside of the hospital. Shout out to our environmental services and hospitals. Shout out to all of those workers. Shout out to our retail operators that are out here still going to work each day. I pray y'all masking up, though, while y'all there for sure. And shout out to our truck drivers that are continuing to stay on the road, and our postal workers that are still continuing. Please, but stay safe. I'd rather not get my mail and lose you. I'm going to let that sink in right there. I'd rather eat oodles of noodles until this thing go than have to go up in Walmart. Please, please, save a life. Save your own life. You might not just infecting someone, but the one that gets infected, because you don't even know you have a pre-existing condition. Hey, it's Pastor Dixon. We all we got. Y'all take care. I love all of y'all. Before I go, I got to let y'all know, okay? Tell somebody you love them. I can't say hug nobody no more. Tell somebody you love them. Just that word. Call up somebody and tell them you love them. Especially if it's somebody that you ain't talked to in a long time, somebody that you got beef with or whatever. Call them up and let them know you love them. It don't take much. Swallow your pride. This message for me. This message for me. We just don't know. So let's make the best of today. And let's make the best of it by reaching out to somebody and just saying those 3 little words. I love you. Y'all take care, fam. I love y'all much. God bless. And remember, we all we got. Peace.